7 o'clock. All right, time being 7 o'clock, Monday, August 5th, 2019. I would like to bring our Board of Health meeting to order. If everyone would please rise and do the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty. First on the agenda, we have illegal dumping, and thank you so much, Linda. Members present, Marty Golightly, Harry Christensen, Alex Haggerty, Linda Dickey, Chris Schultz, and Susan Emery, and in the audience, we also have Donald Goodwin and Thomas Devlin. On the first item on the agenda is illegal dumping. Donald Goodwin is first there, so excellent. Thank you, Mr. Goodwin. Would you please come up and state your name and address?
Donald Goodwin, 9 Wellsden Road in Brockton.
Thank you so much, sir. Would you like to have a seat here?
Thank you, dear.
Thank you. So I understand we have you on our film here.
Yes, I picked the box back up. I thought, I don't read very good. I'm going to get a 4th grade education. And I thought, someone told me that was recycling and I could drop it there. And that's why I did it. And then when I got this, the box was still there. Me and my grandson went back and picked it up and we took it to the proper facilities. I would never do anything illegal doing that. And I apologize to the city of Abington for this.
Does the health agent have anything he'd like to add?
Nope.
So we all looked at the information before, and we have a couple of options. First of all, our option is that we can postpone this and talk about this in private at another time. I don't think we have to render a decision right now. But one of the decisions that we can make is to issue a fine. One of the decisions that we can make is to issue a warning. And
I personally would go with a warning. I believe you.
I apologize.
I don't have a reason not to believe you.
My wife works in Abington. I do a lot of business in Abington, and I would never...
Would you like to put that in the form of a motion, maybe? Do we need to make a motion and vote on it?
I would like to make a motion just to give, which one are you?
Mr.
I'm Donald Goodwin.
Mr. Goodwin.
Yes.
A warning.
Do we have anybody that has any objections?
I'll second that.
Okay, so what we have on the board, we have Linda has made a motion to issue a warning to Mr. Goodwin. Alex has seconded that. All those in favor say aye.
Aye.
All those opposed? So we have all in favor, none opposed. Thank you, Mr. Goodwin. Please try to respect our law.
I will. Yeah. I apologize to the city of Abington. I really am.
We appreciate you coming.
Yeah.
We appreciate you coming.
And I did pick like I said, I did pick the box back up.
Thank you for that.
I would, like I said, when I got this and I realized it was wrong, my wife read it to me, and I said, we got to pick the box back up. Me and my grandson went back in the pickup truck, and we picked it up, and we took it to the proper facilities in Brockton. I didn't even know we couldn't dump anything in Abington because we're Brockton residents.
Well, we hope to never see you here again.
Well, I hope to see you under better circumstances.
Yes,
There you
absolutely.
go. Do you remember where the elevator is?
Yes, I do, dear.
All right.
Thank you
so
very much, and have a nice rest of the
too.
summer. Thank you.
Excellent, excellent. Next on the agenda is Thomas Devlin. Mr. Devlin, would you like to come up and please give us your name and your address?
Yes, Thomas Devlin, 149 Russell Lane.
Thank you, Mr. Devlin. Please have a seat and explain to us your circumstances.
So as before I talked with Marty, I didn't realize that Saturday, not every Saturday was leaf drop-off. I knew that the hours were 9 to 2. Actually, my wife used to be on this board about 7 years ago.
Thank her
and
for her
I
service.
would never drop leaves during non drop-off hours. When I had pulled in that Saturday morning, I know it was during the usual time. Matter of fact, when I saw the gate was closed, I checked my clock, and I thought maybe that the volunteers had gone for a coffee or something or a sandwich. And I had, as you can see from the pictures, I have a car, not a pickup, so I had maybe no more than like a half a dozen bags, I think. And I thought about it for a second and stupidly figured, well, it's not closed today, they're just on a break, so I'll just leave these bags that I have by the gate and they can take them in when they come back, which my wife nearly killed me when she found out that I did that, but like I said, it was just a lapse of judgment. I would never go there during off hours, and it wasn't intentional that I obviously, I know you're all volunteers, and I wouldn't leave my things for the volunteers to pick up. Like I said, it was a case where I had some extra bags beside the garage, and I'm usually not available that time a lot of Saturdays, so I saw them on the way out, I threw them in the trunk, and like I said, when I stopped, it was the first time I'd ever gone there and the gates were closed. I know typically, like, if the weather's
We are
bad.
in need of volunteers,
Yeah.
so if you know anybody,
Yes.
spread the word for us. I think
Good
that
chance to plug that.
Yeah,
Yeah.
yeah. So that is a good chance to plug that. I think that we've heard enough. Does anybody? I don't feel like I need to repeat the options, but if anybody wants to hear them again, does anybody want to make a motion?
I'll make a motion for a warning.
Excellent. All right. So we have a motion from Alex to make a warning for Thomas Devlin. Do I have a second?
I'll second it.
Excellent. All those members in favor say aye.
Aye.
Okay, so that's all for, none opposed. Thank you so very much
Thank
for
you.
coming.
Thank you
Thank
very
you.
much. Thanks for your time.
Thank you.
Thanks for your service.
Thanks.
So thank you.
Appreciate it.
Excellent. Next on the agenda, we have, I believe this is Alex's tackling addiction report.
All right, thank you, Madam Chairman.
Thank you.
So I'd like to start today by, I'd like to dedicate today's tackling addiction report to our neighbor from Brockton, Mayor Bill Carpenter, who suddenly passed away on July 3rd, 2019. Mayor Carpenter was a beacon of hope for people in recovery from drug addiction. From Teen Challenge to the 2016 Champion Plan, Mayor Carpenter was truly a champion for those seeking help from addiction. Mayor Carpenter's legacy will definitely live on, and thus we remember him as a champion. So I want to dedicate this report to him. For this meeting's Tackling Addiction report, I want to report on the next Abington Substance Awareness Coalition's meeting and also share some specific tips we all can take to prevent addiction from opioid misuse and save lives. So first of all, the next Abington Substance Awareness Coalition meeting will be held on Wednesday, August 14th, 2019 at 7 p.m. here in the Town Hall, right on the bottom floor. As always, the Coalition's meetings are open to the public, and we encourage all who want to get involved with the Coalition to help and create substance awareness to attend. If anyone wants any more information on the Abington Substance Awareness Coalition, residents can see their Facebook page and Twitter page, both at Abington Awareness, and their website at www.abingtonawareness.com. Now, as for the following measures for guidance on how to prevent addiction from opioid misuse and save lives, I've used this from the U.S. Sergeant General, Jerome Adams. This is also available on the Health and Human Services website healthandhumanservices.gov/opioids. So these are just some 5 points how to help prevent opioid misuse. Number 1, talk about it. Opioids can be addictive, as we all know, and dangerous. We all should have a conversation about preventing drug misuse and overdose. So with this, it's great. So talking about it, it's great that we have like the coalition in town here that's talking about addiction, going to the high school, going to the middle school, talking to the community. But it also involves, parents talking to kids and, people talking to their friends and family and really trying to help each other through this, because a lot of lives are touched by addiction, or hurt by addiction, I should say. And another thing too, it's great that we're talking about it here at the Board of Health, because it is a public health issue. It's great that I really appreciate you, Madam Chairman, for allowing us to talk about it in the board too, and Marty as well. So second, be safe. Only take opioid medications as prescribed, as with surgeries, as people do. Always store them in a secure place out of reach of children and adolescents, and dispose of unused medication properly. Luckily, we live in a town and a community where we're able. Some communities, unused medication, they have to wait for a whole day to do it in the 365 days a year. Well, here in Abington, we're able to dispose of them every single day if we want to, down at the Abington Police Department, which is great. Which is a great thing for us to have. Many communities don't have that, so that's wonderful that we have that to be safe. Number 3, understand pain. Treatment and other opioids are effective in managing pain and may have less risk of harm. Talk to your healthcare provider about the individualized plan that is right for your pain. I can speak this from experience, having family who have gone through surgeries, hip surgeries, and the first thing that the doctor prescribed was, oh, you take opioids. There's other options to do that. Always have that conversation with your doctor. You know, that's not the first, that shouldn't be the first option, because it's a very addictive substance. Number 4, no addiction. Addiction is a chronic disease that changes the brain and alters decision making. With the right treatments, I should say, and supports, people do recover. There is hope. Again, this is a great thing to have, like the Abington Substance Awareness Coalition, where we can talk and really get through this together as a group, as a community. And it's also, I'm speaking as a civilian too, there's also great that we have, there's only one in town, but the Brook Recovery Center that we have that is able to help a lot of people get control of their lives again. And I've spoken to the owners and the people who work there, and even some of the people who have benefited from that. And it's great to have that in town and really help people into recovery. And number 5, be prepared. Many opioid overdose deaths occur at home. Having the Narcan, an opioid overdose reversing drug, could mean saving a life. Know where to get it and how to use it. We can help through your healthcare provider. The police are definitely a big help with that too. They keep that on supply. I mean, just even in 2018 alone, Abington, 11 residents overdosed. I mean, that's heartbreaking, and it's awful. So, you know, there are things that can prevent drug addiction, but also help reverse in the worst case scenario of overdosing. So with that, I'll leave with this message. Together we can spread awareness and ultimately end addiction. Thank you again for letting me having my Tackling Addiction report, and this has been my report. Thank you.
Thank you, and I'm glad you brought up the addiction report. I'm thinking that, I don't know, maybe we could do it like every other month or something?
Yeah.
What do you think? Or every 3 months, like something, you know, just to space it out a little bit. I'd love to.
Oh yeah, no, I hadn't spoken about this since I think was our first meeting. So
absolutely,
you know, I wanted to respect that with everybody. So
and I want to give everybody else a chance to have their particular issues move forward. Nobody has said anything to me. This is coming from me.
Yeah, no, I know. I appreciate.
So
We're open meeting, all open to all suggestions.
Thank you so much for the time that it takes for you to do that, Alex.
Thank you.
You know, it really is important. Does anybody have any questions for Alex?
Alex, I didn't get a copy of that. If you want
Sure,
on the
yeah,
website, I'll put it on there.
All right, cool, absolutely.
Thank you for that, Marty.
Thank you, Marty.
All right, does anybody have any questions? Then can we move on to the next item? Then the next item is the restaurant survey that went out, and I did ask Alex to photocopy all copies of it. So this has already gone out about a month ago. And did you guys have a chance to look at it?
Mm-hmm.
So any thoughts? I had some.
Is this just for the Board of Health, or is this something that
This
is
already went out to the
open?
restaurants.
Okay, no, I know, I realize that, but like it just goes back to you, Marty, right?
Yep. So I have a public health intern who's doing her master's thesis in the office, and my project proposal was to identify ways we could help train the person in charge of restaurants. And one of those do that. A common process improvement, like I said in the email, is these kind of surveys. So in the future, I will disambiguate myself from the board. I will make sure that I use health department instead of Board of Health. It was a semantics choice as to not confuse the restaurant owners, because a lot of them just they don't see a either or, it's just the one thing. So in the future, I'll make sure that all my process improvement stuff comes from the health department and not the board.
Because when we're banning styrofoam, we're not supposed to care about the restaurants. So for us to turn around and say, hey, what can we do for you now?
Well, ideally, we would like to, I mean, this is a service industry, you know, I'm an inspector, but also, I mean, we're all in the same town, and we want to be safe and identify any problems that they have. Specifically, this survey is because in October of last year, the food code changed. Not a lot of people knew that. And I made a little pamphlet, a little handout to go to every restaurant for every inspection to give them an overview of those changes, examples of 2 of the forms that had to be, that are required now. One of them was a change, and some of the information that could be useful for specific restaurants. And a lot of people didn't know. And so when you have an opportunity to have a master's thesis student in your office, and this was one of those things, this is a perfect process improvement project, how do we do things better? Well, one of those things is making sure that our people in town that are you know, rubber on the road, boots on the ground, do they have all the tools? Well, what's the thing we should find out? And as an environmental and health trainer, ideally, there's a few parts to the study. So then we might do more of these in the future. But I won't use Board of Health anymore. I'll make sure that the process improvement comes from just me and the health department and my interns.
Well, I personally want the restaurant owners to be better than any other restaurant owners, and I really, like, I don't think it had anything, like, Bannon Styrofoam was for the health of the community, so I think that's like a different thing altogether, but I do want the restaurants to have the best owners and the best,
I just
you know,
think that
the
this
best
was no
tools.
emergency. I don't think that
Well,
this should have
yeah, it
gone out
wasn't
with
an
us knowing
emergency.
about it, number one. It's kind of tough for me to get phone calls about
Have them
something
call the office, just tell them to call me. I happily field any
I
questions.
have to answer my phone before I know what the other person is on the other end talking about. It's just like that. I do think that it could have waited until we had a chance to be asked about it. I don't think there's anything in this survey that was urgent.
Well, the expediency was because our intern is only there for the summer. And the quicker we can get feedback, the quicker we can compile that data to see what we're missing. That, you know what I mean? So we have to, the more feedback surveys we get before her time is up, the more accurate our look at the community is. And we've already gotten super positive feedback from MDPH, the epidemiologist there. I'm quoting, "This is a worthwhile project. There are lots of restaurants across the Commonwealth, parentheses, and the entire country, that have lots of repeat violations. If we can identify solutions to eliminate them, it will be helpful." So I'm actually proud of this, and I'm proud of the work that Sarah has done down there, and I think this is important, and I hope we identify some problems that the restaurants have, and in the future, next year, summertime, I'm gonna try to offer some training here, and that's why these went out. So, but next time, sorry, won't be Board of Health, it will be Health Department.
I mean, I
What's
do.
the difference?
One of them is
What's really,
you,
like,
you as policymakers,
Yes.
me as enforcement and tool. So that's the difference. And then the health department also has things that the board is not specifically responsible for policy-wise, like trash and recycling and some other stuff. Unless, I mean, or we can talk about this now and say, hey, I'll do surveys next year, and hopefully the intern will be in the office before we switch to the summertime, once a summer meeting, you know, we kind of, like there was some gap in there. So maybe I can get the surveys before and we can talk about them then. But yeah, I'll make sure that there's that there is disambiguation between the semantics, and that won't happen again.
Well, I was the one that was blindsided by phone calls from the restaurants saying, hey.
We got positive
that's the
feedback.
problem with being in a food business and also being
Yeah,
in
and you
charge.
only got one.
But you guys didn't get one.
Well, you
so you
got
guys
one.
didn't even know.
You got one because you run a food
What, the
business
surveys?
here.
Yeah, you got one because you run a
know.
food business.
Actually, that was a courtesy. We actually thought about leaving you off of that because you have kind of a conflict of interest, but I thought you would enjoy it. So, sorry.
I mean, I like having this feedback back to us. I think it's great to have the communication between us and the businesses in town and what their issues are. Sure, I mean, I do understand where Susan's coming from, talking about just let us know before this goes out or whatever, but I understand this was all in a good meeting and everything, so I respect both.
Cool. We'll do better. Look,
I have nothing wrong with this. I think this is great, Marty, but yeah, I'm not
I'm with you,
frustrated.
buddy. Don't worry. I'm not offended or anything. It's
Yeah.
fine. I get it. Yeah. We'll make sure that we're on the same page next time. Team effort. Team effort.
Yep.
I was also concerned about the postage, because we've had postage issues.
We have a budget for that.
Yeah.
So I think
And
you
I-
had to put money into the postage.
No, I chose to do that because
Yeah.
I don't want to use all, because we also mail a lot of letters of warning. So I don't want to blow my entire budget, or even a half of it on this, because especially in the summertime, when I'm sending out a lot of air, mow your grass, please keep your bugs down.
And I believe you said that you paid for it because you thought it was important.
Yeah.
Because you have the intern and everything you just said.
Yep.
So,
All right.
I will endeavor to do better.
Next is Aaron's mosquito program, which is going to be released. Aaron, do you want to talk a little bit about it?
I mean, it's released on YouTube. That's about it. I met with Dan Daly at Abington Cam. Was it 2 weeks ago now?
Yeah.
Yeah. We shot our video. Talked a lot about repellents and the current state of EEE and stuff like that. Obviously, that's changed. We'll talk about that next anyway. So yeah, we talked about it. We covered it. I talked to Susan about too. In the future, maybe trim it down the video, post it on Facebook, so it's just easily people can view
Yes.
it away. You know, we try and tailor things to how EEE's going in West Nile, whatever updates we have. So a lot of good information he had in there, and we'll be pressing that soon enough, hopefully.
Yeah, one of the things that is coming up is the tires, and I was wondering if we couldn't get it, because I know that July is like a low usage month down at the compost site, but Plymouth County Mosquito takes tires, and we might, I don't know.
Plymouth County does?
Yeah.
The
Yeah, they
mosquito
take
patrol?
them no charge.
Really?
Yeah.
Yeah.
Sullivan
So-
Tire did that one year for us also.
So
They're so
he does it.
expensive.
They do it. So
Yeah.
maybe we can hook them up and just collect them at the compost site, and then they could just pick them up one shot instead of going to
I
every
will call
individual
Dan.
stuff.
That would be awesome.
Yeah, it would.
He said it right on the thing, and because I got to hear it like a little bit before, and when I saw that, I was like, because that's exactly what I did.
Even offering to pick it up.
Well, I mean,
even
in-
like a Rockland and Whitman or something like that.
Now, Sullivan Tire did it for us like 3 or 4 years ago. I wonder if
Oh,
they'd be
yeah.
interested in doing it again. And that was
Yeah.
free, in case someone misses,
Yeah,
you know,
well,
even if we had 2 dates would be
I think
good.
the interest with the Plymouth County mosquito is the breeding ground for mosquitoes.
Well, yeah, that's what I
And
mean.
where August is big, and EEE is our next subject, and because it does all tie together. So that might be a good tie-in, and just so serendipitous for us.
Well, and their big thing too is, you know, during the summer months, is people are not turning in tires and getting rid of them, so that water's just sitting there all summer long. Usually people want to get rid of them before that time, so, I mean, if we have an opportunity to get rid of it and we press it ahead of time, I think it's a great thing for them, so.
Yeah,
Just
it was
thought.
fascinating. I recommend watching it to anybody. So next, does anybody have any questions on that?
What do they do with the tires, do you know?
I believe they cut them up and they bring them
Recycle
to
them.
them somewhere up in the North Shore. So he
Because
says
I know
in the
they
video
make
exactly
mulch
where.
out of tires now, like out of rubber.
Right.
The stuff that the fields are made of.
Cool.
Yeah.
Can you send me a link
Okay.
to that video so I can go on the site?
Absolutely.
Actually, yeah, and I'd like to get it on the Facebook page too at some point. But
Yeah, if
maybe
you want to
we-
trim down to certain sections, I can do that too, or we can just throw it the link.
Yeah, well-
I just think if we trim it down and put the video on itself,
Yeah.
instead of people having to click on the link and go somewhere else,
It
just go
was
straight to the video.
34 or 37 minutes, so that might not be a bad idea. We might get
Yeah,
more
if
views.
we have a 5-minute clip about repellents, I mean, that's a big deal right now, so.
Right. But watch it, it's worth the time. So next up is the update on EEE, and Marty did have a release for us that just came out at 4:30, he said this afternoon.
Yeah. So EEE is a activity is really early this year because we had a lot of rain and we had a lot of the heavy volume of rain. And temperatures are warmer than normal, so EEE threat has been increased in our town to moderate. A lot of the surrounding towns are already in high. So I will hope that we don't get there, but we should plan for it. One of those things you can do is that we can stop all late night, late evening programs at the schools, programs outside, as much as possible. You know, we can't force people not to use the fields, but we can recommend that they don't. You wearing long sleeves, using your repellents like Aaron was talking about, making sure that they have the appropriate EPA approved active ingredients, repairing your screens, the whole 9 yards that are on the mosquitoes and ticks, mass.gov/mosquitoes and ticks. They have videos on there too. They're cute little 30-second snippets. They're over and done with, but you get a lot of information. So I highly recommend that. I think it's only a matter of time before we get increased to high. And that's unfortunate because it usually doesn't happen this early in the year. But
Right now, we're moderate,
They haven't,
so we don't need to stop activity
we don't need
yet
to stop
until we
anything,
get to
but I had a
high.
conversation with the superintendent of schools
Yeah.
today. We went over the paperwork involved. We went over our plan of action when it gets increased, because I think it's more likely when than if.
We have done that.
Yeah.
Were you on the board then, I think, right at the beginning?
right at the beginning,
Yeah, so,
Yeah, we did
so
do
we
that.
used the template
Yep.
from the last time. Apparently it was successful then, so there's no reason
Yep.
to re-break it.
No.
Just kind of roll that thing in. And just be smart, please. Use repellents, fix your screens. Triple E doesn't have the publicist that some of the other West Nile and Equals does, but it is the most serious thing right now, so please take precautions.
And to reiterate from the video too, with the EPA registration, the little, on the back of the bottle, it's in really small writing, so that's where people can find that, so for the people that are watching and for you guys, so,
yeah.
yeah.
No, that was a good read. I think too that, I remember that Dan Daly said that only the superintendent could have the field sprayed. He's the only one that can request that. So that was noteworthy. All right, next up, let's see, anybody else have anything else on the Triple E update? Satisfied with the conversation so far? The only thing is, I don't think that they have found any in animals or humans yet. They're just
Yeah, last I checked it was 0.
zero,
I'll
thanks.
check.
Yeah. Okay, so that's encouraging when, Linda was talking about the levels of severity and such. I think that comes into play.
Well, there's one in Plymouth County, right? This
Chikungunya.
yeah.
Chikungunya?
And we're Plymouth County, right?
Yes.
Yeah.
Yes, so one of
Chikungunya
those, not
is-
Triple E,
yeah.
but one of those.
No West Nile,
No West
Yeah.
Nile, Triple E. Now,
Is it-
I'm just curious, this might sound stupid, but I was just thinking to myself, you were talking about spraying the fields. Do mosquitoes like that astro, that's not real grass, right? Do mosquitoes still go on that?
Yeah, they will.
Oh, okay.
Yeah, it's still.
I didn't know if they, does that actually grow?
No.
It's
But it is
like
surrounded
plastic,
by the
right?
woods, and we're delicious. So
No, I know it's surrounded by the woods. I was just curious, I'm thinking.
No, but you're right. It doesn't. It's not like the natural.
Okay,
environment.
so it wouldn't be as bad.
No, probably not. That's a great. I would
So
love
the
to do a
spray,
study.
you
I
would
might have
want to
call
spray the
epidemiologist
woods
now.
actually, not the AstroTurf, because if you sprayed that, that might ruin it after a while.
I don't know. I wonder if it's an edge treatment. I wonder if they just. go
Yeah,
along
like
the
all
edge.
around that's what I was just thinking.
I have no idea.
I was just curious.
These are great questions because I'd love to find
I was
out.
looking at it the other day thinking, wow, it's really green, and then I was like,
I
wow,
think that
that's
they can
plastic.
breed in
I
water,
didn't
so
realize
even
it was
like
plastic.
if a rock has like a little bit of water in it, then they can
Yeah.
breed there,
Oh,
and
yeah.
then they, you gotta watch this thing.
Yeah,
I will.
They stick
I will-
their
I will
little
watch
tube
it.
It
out.
doesn't take them long, like a week or two, they're.
Yeah, and we have
Yeah.
had an awful lot of rain.
Yes.
So.
Okay.
so I
Empty
think-
standing water, that's the thing to hit home, so.
Yeah, but yeah, he shows you how they little lava and they poke their nose through and get air. It's kind of fascinating stuff. All right, so if we are all set to move on from Triple E, the next up is the Abington Hazardous Waste Day. I thought that'd be nice to announce the Waste Day is September 7th. It is at the Whitman DPW located at 100 Essex Street, and it is from 9 a.m. to 1 p.m. And what's the blanket authorization,
So
Marty?
you no longer have to come into our office to sign a form for authorization. If you have proof that you're an Abington resident and you have the appropriate things that you need to get rid of, you can just go and they'll take it there.
Excellent.
And this is hot off the press. I can't give it to you because it's not approved yet. But this is the new SSRC's Too Bad for the Trash hazardous waste collection schedule. As you can see, it doesn't have like our town in it. It's like go through the printer and all that stuff. But we have our fall all the way to the 16th of November, schedule out. And as soon as it gets approved, it'll be on our website, on SSRC's website, ssrcoop.info, or the health department's website.
Excellent.
And if anybody wants to volunteer for that,
You can count me in. I was there
I
last
will
year.
be in Lake Placid.
All
Nice.
right. Anybody, any questions on that? Moving on, the tobacco update. Did everybody get that? DJ Wilson has us on a little satellite list of stuff. I think that the important part of that email that he sent out was like the last paragraph. He gave us the 3 options. We're going to talk more about that in September and October, but I want to make sure everybody hangs on to that and reads it down to the end, because the 3 options that he gave us I thought were good. So, is any questions on that? Excellent. Moving on to the e-waste day options. I asked for this to go on. I did speak to Claire. I don't know how to pronounce her last name. Galkowski.
Yep.
Thank you. And she's with South Shore Recycling Co-op about setting up an e-waste day and the options. She said that it's cost between $250 and $500, and sometimes the thing can be offset. I think we kind of do the same thing with the compost site, but if anybody is interested in this, just thought that I'd throw it out there. I get a lot of people asking for an e-waste day. But I think that they have a memory of when, you just pile up and everything was free. We'd have to charge for TVs. Claire says that, that you can offset the $250 to $500 setup fee, but it's just moving forward, something that we would have to look for. We could probably get a couple of groups to pull it together, but just an idea. I've heard a lot of people mention it. I think a lot of people start to think about it when they start buying new things for back to school. And it's like, oh, what am I going to do to get rid of this other thing?
That's the anything with a plug, right?
Yeah, that's e-waste. E-waste would be anything with the plug. But like the last time I think that there was one, it was a bit of a problem because of the TVs. And I think that's the way it is now. They charge for TVs. It's just that's it. And we'd have to pass that on to the residents, of course. Marty mentioned that he had looked into it.
We exhausted all of the research that we could for this. It was just so cost inefficient. It was so expensive. We thought about partnering with other municipalities that were local, and that actually ballooned the cost instead of making it less. We were going to do anything with a plug day, and we weren't getting quotes anywhere near 500. It was, depending upon how much we got the truck full, it was closer to $5,000 and $6,000 for them to set up and take everything away. And we must have talked to a dozen different people, and it just wasn't cost efficient. So I'm pleased. If you get any ideas, if you know anybody, send it my way. I'll make it happen. It's just got to be, we can spend a little money to do it, but.
Right. I might still poke around with Claire on this.
I'll make sure you have the next dates for the meeting.
Thanks.
I think it's here, actually.
Oh, that'd be great. Nice. All right, so I just like people to know too that we are working on things, just keeping you hanging out there. Next on the agenda are the cooling stations from July 20th. So we did have cooling stations opened. There were attendees. Their MRC is having a meeting about how to do things moving forward. Aaron, you had made mention in a group email, and I was curious as to what your thoughts were on that. If you wouldn't mind sharing them. I did put it on the agenda with that in mind.
Yeah, I'm just looking forward. I'm in another program in Scouts. Chris is in it with me. It's venturing. There's a top project for that.
Yes, I have neighbors interested in that too.
I will probably be working on that within the next 6 months or so, and I was looking at doing something with cooling stations anyway. So I'm still gathering some information and I'm still looking to talk to some people and figure out what I can do to help, if anything. So I just want to throw it out there that that's something I'm looking at doing, and hopefully in the future we can kind of work together on that. So
Okay.
I want to get a little more info and know what's going on. I'll bring it to the board's attention too, but that's
Great.
kind of what I got going on right now. So
Great, because I think that the chief has got something, not quite that, but along some of those similar thought processes at the very least.
yeah, I've been looking to reach out to him at some point. We can touch base and figure out what we want to do. So, but until then, you know, I got to do some more research. So.
Yep. I'm gonna stick my nose in that one too. Because all the other stuff. So yeah, I think that's good. I don't know if, yeah, I think that moving forward, I don't know if using the school for something like that would be the way to go. Because it's a big space. But I guess, how can you know how much you're gonna need?
Yeah, well, you know, there's a difference between the cooling stations, cooling centers, and then the shelters, which the school is probably more equipped to be.
Yeah.
You can just go, you know, cool off, maybe get something to eat if they need it or whatever.
Oh, okay.
You know,
Yep.
it's probably a little bit easier,
Yes.
especially for just a
Yeah.
limited time use. So, just a thought.
There we go. All right. Anybody have any other questions on that? Oh, all right, then moving on. So we have the minutes next up. I have the, if you don't mind, I'd like to do the 6/17 because we're all here, so we must, because I think that's why we haven't been able to do the 6/17 one. Who do we have? Me, Chris, Alex, and Aaron.
I'll make a motion to accept.
Excellent. So Chris has made a motion to accept the minutes on June 17th. Do I have a second?
I second.
Excellent. All those in favor say aye.
Aye.
So that would be
Was I there for that one?
3,
Or the other one?
excuse
Was
me?
I there for that one?
No, you're excused.
Okay.
Yeah,
So
so
I
that's,
abstained.
I was just counting up.
That's
So
why I was-
that's 4 with
You wasn't here for
one.
one.
You're going to abstain, right? Because you were.
Yes.
So 4, 1 abstention, and 0. All right. So we'll just sign those. And then the next one up is July 1st. Does everybody, do I have a motion to accept the minutes from July 1st?
I'll make a motion.
Do I have
And
a
I'll
second? Linda seconds. All those in favor say aye.
Aye.
Those are 5, no, sorry, Chris wasn't there. So
It'll be 302.
302.
302. Excellent. Do I have a motion to adjourn?
Wait, I'm sorry, I have a addendum, excuse me. I literally just got a DPH email. There is a conference call tomorrow at 1 o'clock. I will email you all the details of how you can log in and listen in. On
Okay.
AAA risk of human cases.
All right, thank you.
Oh,
Thank
great.
you, Marty.
Thank you, thank you. That's all right. I think that the Board of Health is allowed to do that.
I'll be in work. What time do they do that?
No, but we're allowed to add
Okay.
something on the agenda
Yes.
if it just happens
That's why
like
I
that.
just-
Yeah, so
1 o'clock.
I was
Okay.
just reading.
I'll make a motion to adjourn.
Second.
All those in favor say aye.
Aye.
Nobody opposed? Okay. All right, so Mary's going to be very disappointed because
I'll get the camera.
Thank
missed a
you.
lot of meetings.
Uh-oh, what did it stop?
Yep.
Oh,
It's like, make sure we're on the same video.
Yeah, she'll just have to watch it.